There's this message that's come out heavy-handed for me in grad school, and I've talked to a lot of other people who've gotten the same. This has been encoded into the National Association of Social Work, the American Counseling Association, basically like across the board, that part of being a therapist means being a political activist. What are
Yeah.
you seeing in that regard?
I'm so glad you brought that up because that's something I didn't talk about earlier and I should have. My code of ethics as a mental health counselor says nothing about activism. So I am not required, nor was I ever taught to engage in any of that. The social work code of ethics, it's baked in. You have to be an activist or you're not doing your job. The mile high picture of this is social work is a out in perspective, community down to individual. Mental health is individual out to community. And so for social work, the answer is always in community, therefore activism has to happen because we have to change the community. For mental health, the individual holds all the keys or answers to whatever's going on in their life. They have to change their thinking or their behavior or heal the wounds or trauma from their past to see the world differently, and then they can change their own lives. All the power resides within that individual. So we would just have two drastically different perspectives. And when you have that, and then you add on top of that critical theories where there's these baked narratives of oppressor versus oppressee, and you have a patient walking in, we have people making assumptions about them based on what they're seeing in front of them. Are you male or female? Are you black or white? What's your religion? So we're casting all of these narratives onto patients before they've even begun to tell us who they are.